Hi, I'm Natalie Buckley, and for my PICO question for the summative assessment project is, in adults with anomia due to aphasia, does verb network strengthening treatment, also known as VNEST, increase verb generation in comparison to semantic feature analysis, also known as SFA? In this presentation, I'm going to be explaining both treatment techniques of VNEST and SFA, the theoretical framework behind VNEST. I'm going to be explaining a case study and the case characteristics. I'm going to share both external and internal evidence. I'm going to share a treatment plan that I created, my conclusions, and an evaluation of my evidence-based practice. According to Edmonds in 2016, verb network strengthening treatment, VNEST, is an intervention strategy that is used to improve word retrieval in those with aphasia, and specifically those who display anomia. This intervention is meant to focus on whole sentences and generalize into real-life communication situations. Consistent practice of this treatment intervention creates verb networks in the brain. So to do this treatment, the clinician would first set out cards labeled who and what, and then give a target verb to the patient. So in this case, in my example here, the target verb is measure. Then you would ask the patient who might measure, or who might do the target verb. Then, once they name this, you'll ask the patient what this person might be measuring. So in this case, the first example is the carpenter measures wood. So then you would ask the patient to read their created sentence. Then once you go through 3 rounds of this, then you will want to expand on the sentence with cards that are labeled when, where, and why. So then you would prompt the patient to give responses to your prompts of where, when, and why, and then have your patient read the whole sentence. So then you would read different subject, verb, object sentences and ask the patient if this sentence sounds correct. Then you want to ask the patient lastly to state the verb again to really form this connection in the brain. According to Edmonds and Babb in 2011, the theoretical framework behind VNEST is that verbs are at the center of syntax formation and semantics. So verbs are at the center of creating sentences. So therefore, increasing verb generation will overall aid in increasing syntactic productions. And these verb networks are formed in VNEST by the relationships between the verb and their thematic roles, the agent and the patient, or the who and what of the sentence. Another treatment intervention for anomia is semantic feature analysis, or SFA, and according to Wambaugh et al. In 2014, this is an intervention strategy that improves word retrieval abilities that usually has a focus in noun retrieval. It can be modified slightly in a way that will target verb retrieval, which is what we are talking about today. And SFA prompts the patient to name the target picture in front of them, then name corresponding features that describe the picture. So you'll first ask the patient to name the target picture, then you'll ask what category or group the picture belongs in, or the thing in the picture belongs in. Then you'll ask what it is used for, you'll ask what it does, then you'll ask them to name the properties or describe it, then you'll ask where it is found, then you'll ask the patient what it reminds them of, and then you will ask the patient to name the word again to solidify it in their brain. For my case, I chose a 74-year-old white female who's an English speaker. She had an acute ischemic left MCA stroke. She has moderate expressive aphasia, and this was shown on the Western Aphasia Battery Revised, the WAB-R, and an informal assessment of connected speech. This aphasia is characterized by severe anomia and reading difficulties. Her strengths include her comprehension and her attention and memory. She is seen in an outpatient rehabilitation setting, and she really enjoys spending time and talking about her family, especially her young grandchildren. The main challenge and difficulty that this specific patient faces with her aphasia is her anomia. She has severe anomia that impacts her not only at the conversational level, but also even at the single word level. And this is the main target that we work on during her speech therapy sessions and what she usually asks to work on. And she is known to often get frustrated and when she's speaking and states that she knows what the word is, but she can't say it. So to improve her word retrieval skills during sessions, I have challenged her in both VNS tasks and SFA tasks across many sessions. And she does relatively well, but goes at a more slow pace and, like I said, often gets frustrated with her word finding difficulties. After a thorough literature review, I found 3 different studies that support the increase of verb generation in VNest as a treatment intervention. For my first piece of external evidence, I found this article, The Effect of Verb Network Strengthening Training on Lexical Retrieval of Content Words and Sentences in Persons with Aphasia by Edmonds et al. In 2009. And in this study, there were 4 participants. They all had aphasia due to left hemisphere strokes, and they were 9 or more months. They had the stroke 9 or more months before this study occurred. They were all monolingual English speakers, and they had impaired word retrieval of both nouns and verbs. They were also all right-handed prior to their stroke. So in this study, it used a multiple baselines approach. So they had the baseline data, treatment of trained verbs and probes for generalization of untrained verbs that they took data on, and a 1-month post-treatment maintenance. And the results of this study show that after treatment, all of the participants improved in their percent accuracy from their baseline in both trained verbs and untrained verbs that were not used in the study. And another piece of the results is that 3 out of the 4 participants showed improvements in their connected speech overall. My second piece of external evidence is this article, The Effects of Verb Network Strengthening Treatment in Persons with Aphasia. This is an extension and replication of previous findings, and this is done by Edmonds et al. In 2014. So in this study, there were 11 participants, and they were never in any previous VNS studies before this one. They all had a diagnosis of aphasia according to the WAB-R. They were all monolingual English speakers. They were all right-handed prior to the stroke, and they had no previous learning disorders or drug and alcohol abuse. So like the last study, this study used a multiple baselines approach. So they took data at baseline, during treatment, post-treatment, and at the 3 months post-treatment maintenance stage. The results of this study showed that there were significant improvements at post-treatment and maintenance data collection periods. And this study shows that VNS increases specific and generalized word retrieval skills and overall sentence production in both structured conversational tasks and unstructured spontaneous conversation tasks. For my last piece of external evidence supporting VNest, I looked at a study that looks at the telerehabilitation with verb network strengthening treatment in 2 participants with mild to moderate and moderate to severe aphasia. And this was a single case experimental design study by Torrenson et al. In 2024. Although this is a telerehabilitation study, it has the same effect of, or the same methods as normal VNest would have, so I thought that it was still appropriate. This study has 2 participants. One dropped out during the treatment due to them not finding it VNest as functional, which I did note in the bottom left-hand corner. Having only 1 participant in this study is definitely a limitation of the study. All the 2 patients did both have subjective anomia, and they participated in this study more than 6 months after their stroke. They were both Swedish speakers as their first language, and they had unimpaired vision and hearing. So this study also used a multiple baselines approach. They staggered their baseline and took data then. They had a treatment phase, and they had a post-treatment follow-up. And like I said, this was also a telemedicine, telerehabilitation setting. And the results of this study is that the participant who stayed till the end did improve from baseline in both their trained verbs and untrained verbs, and showed evidence of generalization in confrontation naming after this study. I lastly found external evidence supporting SFA in verb generation, and this was the semantic feature analysis application of confrontation naming in actions in aphasia. And this was by Wambaugh et al. In 2014. And in this study, there were 4 participants who had chronic aphasia that was stroke-induced. They were all English speakers, and none of the participants had a history of any speech or language difficulties before the stroke. So in this study, SFA was used, but it was modified to elicit action verbs rather than the usual SFA that promotes noun generation. So this was basically done by several of the feature categories being changed. And the accuracy of trained and untrained verb naming were both of these had data collection, and data was collected both pre and post treatment. The results of this study showed that all participants showed improvements in naming trained verbs following this treatment, although no participants generalized this improvement of trained verbs into verbs that were not used in the study or untrained verbs. I also have internal evidence that I want to share that supports VNest as the intervention strategy that is the most successful in increasing verb generation. I have used both VNest and SFA in sessions to promote word retrieval in general. But as we know, VNest is the treatment that specifically targets verbs, while SFA is a usual intervention strategy to target the generation of nouns. And because of this, I believe that VNest will be the more successful in increasing verb generation. I have also had clinical experiences with several patients that I've worked with that have shared that they feel that VNest is a more functional treatment intervention that generalizes more into their everyday lives, while SFA is more of a 1 to 3 word generational task rather than VNest that has a part that expands sentences. And this is how people communicate with each other in their everyday lives for the most part, and this is often a goal of someone who's living with aphasia, is to get back to how they normally conversed, or at least get back most of it as much as they can. To integrate all of my evidence, I first have my client perspective, which is my patient who I talked about earlier, her perspective specifically. And she expressed that she feels that VNest is the most functional to her, and this helps her more in her everyday life. She also shared that she doesn't particularly enjoy SFA and often gets a lot more frustrated by the prompts in that task in compared to VNest. She also personally has a goal of communicating with friends and family in a more fluent way, and she knows that she wants to expand her syntax more. So VNest is her favorite in comparison to SFA. I also have clinical experiences that I have seen VNest used with not only this patient, but other patients with word finding difficulties. And this almost always has a greater success and understanding than other treatments. And the patients really understand how this could generalize into their communication in comparison to SFA, which always gets more of a buy-in. And then the external evidence shows that VNest is a more successful approach in the retrieval of verbs specifically, which is what I'm looking at in my PICO question, and that VNest uses an expansive and semantic approach in comparison to a more single word or small phrase approach like in SFA. I developed a treatment plan that implements VNest into treatment sessions for a patient who has word finding difficulties, and the patient would participate in VNest 2 times weekly for a total of 3 to 3.5 hours each week. This is supported by Edmonds' study in 2016. The patient will work towards naming the subject and object of a given verb, and then expanding this sentence using where, when, and why prompts. I will also plan to assess generalization of untrained verbs throughout this plan of care by implementing structured and unstructured connected speech tasks through conversation. In conclusion, my patient has a moderate expressive aphasia that's characterized mainly by anomia and also some reading difficulties. This patient has goals of communicating using full expanded sentences, more like she did previous to her stroke, and she also enjoys participating in VNest and finds it functional. VNest overall creates verb networks that increase syntactic productions over time the more you implement practice. And I believe that VNest will be the best suitable treatment intervention and main treatment for this patient. My review shows that the external evidence supports VNest for verb retrieval and generalization overall compared to semantic feature analysis. So to evaluate my evidence-based practice process, I first want to acknowledge that I am biased to VNest just because of my clinical experiences, but I also kept an open mind during my literature review and with hearing my patients' opinions as well. I also chose an ideal candidate for this particular treatment who does enjoy VNest over semantic feature analysis just because it works better for her personally. So I realized that other people might enjoy semantic feature analysis over VNest, and that's okay. And I also chose a dosage amount that works for this patient, but is also proven to be evidence-based in the literature. I've also read through many articles and allowed myself the opportunity to gain all the information required to form my conclusions and support VNest as the best intervention strategy compared to SFA for the generation of verbs. Here is a list of my references, and thank you so much.